Restoration specialist in Newport Beach, California. I want to talk a little bit about how scars affect mental health tonight. I'll wait for a few more people to join us, and we'll kind of delve into this topic and also showcase a little bit about what I do for scars. That's been the big theme for this fall and winter. A lot of patients are trying to get their skin fixed. They've been doing it for throughout the whole year, and now some of them are coming in for a little bit more just to be able to improve their skin before the holiday time. And I want to talk a little bit about what has really been happening for patients who suffer from scars and really all sorts of different skin conditions, and even volume loss and pigmentation, because all these things actually can affect patients' mental health and just their well-being. And during the holiday time, there's a bit more extra stress for patients, and they feel as if there's more pressure to look good for families, for family members, and for friends. Some patients were last week especially really trying to get some filler work done, things like that, in order to look good for Friendsgiving and Thanksgiving, which is nice, but there is this element of stress that I want to talk about, and sort of societal pressure that I think people who look at themselves in the mirror and feel like they were robbed of what their face could have been feel really every day, and they feel like this suffering that's a bit silent for them, because they don't know if other people empathize with that. They don't really know if there's anybody else that also suffers through that. And it's kind of clear with the patients I deal with. They open up because I talk a lot about that over here. But I don't know if necessarily people in the world kind of know about that. And they don't know if the fact that almost everybody has something that they're not super comfortable about, or they're not super confident about, and they want to change, and they want to feel better about themselves. And so we kind of focus on this body dysmorphia topic without recognizing that almost everybody has some element that they're concerned about with their looks, but sometimes it could be overwhelming, and a lot of times the reason why it becomes overwhelming is because there's external factors, there's external stressors that now kind of push it over the edge for them. It's sort of like was always there, but it was like kind of manageable, because like your work was otherwise okay, friends are otherwise okay. There wasn't like really like, a big event happening, things like that. But then suddenly, maybe your friendships aren't growing as well. There's like people are making certain comments. Maybe they're getting a little bit more jealous of something. Maybe there's something else that's going on with them. And now on top of it, you have the holiday season, and you're stressed out because maybe like your mom always commented about your skin, or someone else in your family commented about your skin, or just want to like kind of showcase to them that you're in a good place in life, and you just want to prove it to them or so. And so now there's this extra stressor, and now kind of all the other stressors now get affected and essentially start rising up, and now everything gets compounded and everything gets really, really bad for patients. And it's something I always notice really every year around this time, during the holiday time, with the amount of stress that happens sometimes for patients. And it's, so I think it's something that we should probably all really kind of work on and talk about, because it's, not really delved into. Nobody really kind of admits that they have some insecurities. Nobody ever admits that they, maybe feel as if they aren't looking the best sometimes. And they feel like there was, a scar on their face that they didn't have. And now people are noticing that scar. Maybe they're not noticing the scar, but they just feel that way. And now like it gets really ballooned up during the holiday time, because now it's an additional stressor for them. So it's, an interesting phenomenon, because it's like certain things we could control and certain things we can't control. I think that, like I've said it before, but like, I really do believe that the people around you, if they're commenting about the way you look, if they're commenting about, the fact that you have scars or pigmentation, kind of pay attention to the way they're commenting it. If it's making you feel bad and poorly, and they're not really changing the way they talk about it, I think you probably should separate yourself from them, even if it's like a close family member, honestly. And maybe they're just a toxic person that you really shouldn't be around too much, because they're trying to bring you down too much. And if it's really something else, external, then kind of see if that can be fixed. If it can't be fixed, there's something we could do though. What I could do is work on this portion of things. I could work on, your skin. I could work on the pigmentation issues that you have, the scars that you have, the volume loss that you have, all those things. I can improve those things so that if there are other stressors in life, they don't really tend to push anything else over the edge now. And I'm happy to do that. It's exciting and really fulfilling for me every single day to do that. But I don't know if everybody quite understands how many people, like if you in a private conversation with a patient and with privilege, people who otherwise could be considered very attractive, who would be concerned about the way they look about certain things. And I'm not trying to diminish them at all. Actually, I think that it's important to recognize that just like something about their looks, they want to improve, and it's something that's bothering them, and it's totally fair and it's okay. But other people may think that that person's life is totally perfect and they have a perfect skin and they have perfect this. But really, almost everybody's sort of suffering from something like that. And occasionally, other factors have compounded together and put and basically pushed things over the edge for them, and now they have more stress. And I don't know if like people who are suffering from like more severe scars or suffering from like more pigmentation issues or volume loss and things of that nature truly understand how big like the community is really, and like how wide of a net it really is. And it's sort of because like people just aren't honest about stuff. They just don't really talk about it. They don't really say it. And I really, really wish people would. I really would. So, I don't know. But personally, I think that it's something not really talked about. Actually, it looks like I did make a mistake. I said affect instead of affect. Thank you for that correction. I will double check and put that there. I was thinking about that myself. I was like, usually it looks a little bit odd, but I appreciate you checking up on that. And I like that also, by the way, yesterday I was kind of upset at the very end. People were kind of fighting in the chat thing. And normally it's very, very cordial and everything like that. And so I was saying to myself that like, or I was saying on the live there that like really like in general, try to like kind of be more forgiving with people. And like if people kind of come across a certain way by text, it could be just because they just aren't communicating by text properly. Instead of sort of assuming the worst of somebody, maybe just think maybe the person's just not capable of presenting it away. So maybe they should just say it in a different way. And kind of like, recognize that there's different gaps with everybody's education or the way they talk. People come from all over the world too, things like that. And so kind of instead of like jumping to more towards anger with anybody, really just kind of think maybe like there's coming from a different approach, and maybe there's a way that we could solve this. And even if there's not, like, okay, we'll figure something else out to work on and improving, whatever your experience is for anything. I think that like just as a society, I think we jump way too quickly towards anger, towards a lot of things. I was going to get a sandwich the other day, and I was pulling into a spot, and the lady was like glaring at me, super upset in the car. She didn't have her brake lights on or anything. And she's super upset that I was like parking next to her because she was about to pull out. But like, man, like, why are you so upset? You didn't even have your brake lights on. I just was coming in and like going into go get lunch right there. Just like, calm down a little bit. And like, but it was just literally like, how would I even know? And even if she did have her brake lights on, which she didn't, about like, even if you did, like, just relax a little bit about things like that. Like, it's just like, sometimes people just are getting way too angry in society now, and they're causing more stress for other people, and they're making people feel really bad. And it's just getting like really, really, just like spread around by everybody. Everybody's sort of feeling that same stress now. And I think we just like, at least one part of aspect of things should be that we kind of like just recognize that, almost everybody's in the same boat. It's like everybody, like, the stranger that's sitting there across from you, like they're also suffering from something. There's something else going on in their mind, and they're worried about something. And don't necessarily feel like, just because you have very, very serious issues that person doesn't have a serious issue. And Audrey saying, this mental health thing, so true. I'm struggling so much lately with my mental health and scars. I'm sorry to hear that, Audrey. Most people with scars would say the same thing. I mean, most people would. And, I had a patient today, very, very severe case, actually. I took a long, long time with him. It was like very, very involved. And he wasn't even the worst scar case I had this week. And it's interesting because it's like, when you're looking at it, this particular patient may think that his scars are like the worst scars ever. And it's, there's other people that I had just this week, which were worse scars. And it's not to diminish him at all. I'm just saying that, like, sort of, recognize that there's other people that are suffering from this, and kind of, be a little bit empathetic. And maybe they're not necessarily having scars, but maybe there's something else inside, or like internally that happened, or anything else. And nobody really has like this full happiness because of the way the system is right now. And it's like, we don't really just get to achieve and just live our life the way we want to completely. So it's like, just accept that everybody's kind of going through this and going through the system the same way. And maybe we should be able to like kind of have more of a community and recognize that almost everybody is suffering. And we could maybe potentially help other people, but if we can't help other people, then at least just like pause and like recognize and give them some space to like kind of help themselves out then. Landon Winter saying, do I cleanse my face with a cleanser before using clindamycin and tretinoin? You don't necessarily have to. You can just use water. But if you use a cleanser, just use a gentle cleanser, or like Cetaphil gentle cleanser is fine. Let's see here. Triple Period is saying, I don't have acne or never had any at all, but why am I getting deep scars? Is it sun damage? Yeah, it could potentially be sun damage, but it's tough to say like what exactly is happening with your skin without knowing why you would have those deep scars. Maybe there's something internally in your skin that we should take a look at. Maybe there's something that is being missed over here. Let's see here. What are you inserting into the scars? Well, I was using a paintbrush at one point. That was what I was doing for TCA Cross. So if that's what you mean, that's a paintbrush right there. Is that what you're referring to? I'm not sure exactly what you mean by that. But the other, I don't think we showed it on here. Other times what we're doing is subcisions, where we go inside and actually break up the scar tissue. User 13 saying, had a great experience at your office, but didn't like that there were 9 girls taking pictures for the before. So you're saying before you, there was people that had to take photos? Is that what you were saying? Because we do usually always have to take photos for patients before they do treatments, but I'm kind of curious what you're specifically saying so I could address that with the team there. Nishan is saying, is TCA and excision a multi-visit procedure? If so, is it days or weeks? Yeah, it's multiple visits. It's spread out over several months, really. A lot of times you really do need, for deep ice pick scars, multiple visits for those deep ice pick scars. Omami saying, I have an SD client who is super sensitive and allergic to nickel. Moisturizer Rex. Vanicream. Vanicream is a great option there. Georgie saying, so my first session, they did not get all the spots. Is that normal to even the skin? Just curious. What do you mean for spots for what? Like for scars, or what we're referring to? Esperanza saying, can you do a CO2 laser treatment alone for a patient, or do you require combo treatment to be done? Well, it depends. I mean, I'm not like saying that you can't do CO2 laser, but if it's better for for just deep lines and wrinkles, sure, that's fine. But a lot of times you do want to do different things for scars, not just a CO2 laser. I'm not the kind of person just is going to throw a CO2 laser at patients. Just to be honest with you, usually you have to do a few different things, not just a CO2 laser. Let's see here. I lost my place with everyone. Thoughts on Zeo skin products? I mean, we used to have a lot of them. I don't really find anything to be particularly amazing. Nothing really like stuck out to me, which is why I really kind of just shifted gears completely, because I thought that was supposed to be one of the best lines. I used to use it also when I was a kid. I really do feel like it was pretty harsh. I really do. I didn't really think that it was going to be beneficial for a lot of patients. How do you get rid of cortisol face? So are you somebody who has high cortisol levels, or is that what you're saying? Are you saying that you have something that's like retaining salt or fluid in your body? Audrey saying, do you think filler works better than CO2? I heard a doctor online say that and kind of surprised me. I'm not sure what they're referring to. Better for volume loss. Yeah, volume loss, it could be good. But I mean, for what, I guess, is the question. For some sort of wrinkles and fine lines, then maybe. But otherwise, I'm not so sure what that would be for better for fillers. Let's see here. So how do you get rid of cortisol face? I mean, first of all, just double check to see if you truly have high cortisol levels. You should solve the high cortisol level, and that's gonna solve it. Were you on like steroid for a prolonged period of time? I guess I'm a little bit confused about why you think that you have cortisol level that's high and you have cortisone face. So you do have high cortisol levels, and are you on medication to reduce the cortisol level? Because those are things that you should be doing to help with symptoms of cortisone puffy face. Have you ever used PicoWave Resolve, and what are your thoughts? I haven't used that. That's a 1064 wavelength. We have another one, which is called PicoCare, which is basically the same process. But I haven't used that particular brand. It's the same though as the PicoCare. It's good for tattoos. I think it's a good device, a good wavelength for tattoos. For melasma patients, I do actually prefer really more the PicoSure, especially for lighter skin type patients. So like Fitzpatrick 1 through 4, PicoSure is really good. The best things I think though really are going to be more like topical creams, things that are like especially strong sunblock, and then we could take a look at energy devices. But I'm not sure what you're referring to for why you need to do PicoCare. If that helps you, if you need more explanation, I guess just to say, then I'll be happy to help you. Let's see, where was I at here? Can you do skin lightening treatments? Well, I could help you with just getting back to your real natural skin tone, but I don't go lighter than your real natural skin tone. I never do that. I don't believe in doing it that way. I think it's unethical and potentially catastrophic for some patients. It could cause hypopigmentation and other consequences. Sometimes certain medications, it's even liver treatment. So I would not recommend that. Let's see here. Anyone else that I should do? If you were to do TCA Cross, would that help the appearance of the acne scars? Well, it'll help with these kind. These are deep ice pick scars, so it'll help with the deep ice pick scars. I was going to show you at some point also how I trace certain scars, like especially like the thicker edges of the scar. I'll get a video of that at some point too, which is it's a really cool process, essentially just how I go along there and essentially trace it out. What's the treatments for KP? So there's a lot of different options. Of course, you don't want to overly dry your skin. So that's one of the biggest things. Sometimes people are overly drying their skin, even like with baths and in the shower with like very, very hot water. Sometimes that could exacerbate it. But the easiest thing actually I find is one of the best treatments is actually something with urea. So rough and bumpy. So rough and bumpy actually works really well with urea. It works out. Lactic acid, salicylic acid, all good, but I do think that they're a little bit more irritating than urea. So consider it urea. And then, like I said, just being careful with like the kinds of cleanser you're using. Just try to use more of like a gentle cleanser. Cetaphil gentle cleanser is actually excellent. It's a really good option. Even Dove soap is actually good too, interestingly enough. So, consider those instead of potentially like things with fragrances, or like if you're taking baths, just be careful with like hot baths or hot showers in general. And I lost my place here again. 1 second. I know that I had a bunch of questions. I kind of missed a few in a row. So if I missed you, just feel free to re-ask that, because I sort of lost my bearings there for a moment there, because a whole bunch of more questions came on and then I was supposed to hit something there. But in general, though, this is what I'm showcasing right over here. This is TCA Cross. This is for ice pick scars, deep ice pick scars. These patients a lot of times are told to do microneedling sessions, multiple microneedling sessions, and nothing is really going to solve that quite like TCA Cross, lasers, resurfacing, sometimes excisions. All those treatments are going to be more beneficial than microneedling. So I don't recommend microneedling for ice pick scars. Maybe for like mild type of very, very mild like skin texture, it'll help for that. But otherwise, it really wouldn't help actually for those. Why is a hot shower bad? Well, the dryness could potentially end up exacerbating your KP. An eczema, for example, it could also cause hair loss, even, and skin irritation. That's you definitely should try to avoid hot showers. So more lukewarm showers is really ideal. And another thing really to pay attention to is more with just the type of water you have. Pay attention to your water. Really, like I know I've said before, but like take a look and seeing what kind of water concentration you have. If you have a lot of minerals, if it's really hard water, double check that. And if it's something that you may want to, if you do have hard water, consider a water softener. One of my patients actually, she does have a water softening company, and she was telling me it's from like Japan, and they do a really high level of that, and they also test water samples for free. She's somebody who is really big on that. And so I was like, that's something I've noticed myself. I've noticed for some patients, and they're out of state, some areas when they're recovering and in their water quality was bad, it ended up being something where it prolonged the recovery time. It's like really, really unfortunate because it turned out that like they had their whole life, they were putting this harsh water on their face that potentially caused more irritation. Lizette is saying, I've done Morpheus 8 and laser CO2 and microneedling, and I feel it's somewhat helped, but the scars are still there. I'm willing to try TCA. We'll schedule an appointment soon. Look forward to seeing you. You'll be able to see me over, just go to drqazi.com. You can book an appointment that way. We'll help you out with that. So Matcha is saying, do you provide letters of medical necessity? Any issues with acceptance rejection for use of FSA funds? I know we've had patients that submitted it that way, and I haven't had any problems with that, to be honest with you. I've done V-beam treatments to address discoloration. It's been many, many years. My scars still seem to be a red-brown. Is that normal? How do you address this? Well, you still want to clear up that brown, you still want to clear up the brown pigmentation, usually before you do the red. And then once you clear up the brown, it's a lot easier to tackle those vessels. So maybe that's what ended up happening. Usually what I do is the pico laser, clear up the brown pigmentation, and then I'll tackle the red vessels. Brad Harris is saying, I heard Alma. Let me go back to that question. It's kind of skipped here. Let's see. Brad Harris is saying, I heard Alma Hybrid is the best CO2 fractional non-ablative laser. True. Don't worry about the brands of these lasers, honestly. Just don't even worry about it. Like, as patients, don't even worry about it. It's irrelevant. For the vast majority of these things, is irrelevant. No matter what they say, I've used so many different devices. I have like 27 different lasers right now, and you never hear me really like going rah about brands. And it's like, just because like I discovered that it doesn't matter as much as they say it does. It really doesn't. Especially things like CO2 laser. I just don't feel like it's that big of a difference. The gap is not huge between the differences of the CO2 laser. So anybody who's like going out there and telling you it's just the best laser all time, maybe for that dude, I guess. Well, it's a CO2 laser. It's not like it's going to be like that much better than other lasers. I think I like the fact that my CO2 device has like a surgical handpiece, but other CO2 lasers also have a surgical handpiece. So like that's why I'm not like just running around and jumping up and down and saying I have the best devices. Like, I have cool devices. I have great devices for me. I have devices that like work out really well for me, and I love doing those devices. But like some other people may be really comfortable with their device, and that's totally fine. So as like patients, don't like stress out about the devices sitting out there. But if it's CO2 and 1540 blended, it doesn't matter really. I could, but for me, I never do it that way because I end up basically doing ablative and fractional CO2, and then I top it off with a fractionated erbium laser, pro-fractional erbium laser. So I do it that way, but it's like, I don't know what the reason why somebody would say this is the best laser and the best way of doing it, because I actually think that the surgical handpiece of the CO2 laser is the best for a lot of scars. I don't see almost anybody using it that way. Like the way I do it, actually, I was planning on showing a video about that. At some point, I'll show it. And we have it on our story. We may put it up soon, but you'll see like the way I'm tracing the scar is very, very different. It's very, very different. I do that where it's like just a tiny little spot, and I'm going around the edges of the scar and just constantly going at it. And that works out really, really well for scars. So I'm not sure why, I would need any other tools or I would ever say that some other hybrid method is better. But I mean, it could be like great for, just resurfacing process in general. It's a nice option, I'm sure, just for resurfacing and you want just like a nice way to fix your wrinkles and fine lines. Sure, but acne scars are very, very different than that. And even like deeper lines and wrinkles are different, because I find that really you still have to use the more surgical tools for those deep lines and wrinkles than these fractionated tools that are out there. That's what I feel. I do a lot of it. And it's like, I found that like just a fractionated, even blended approach doesn't really change too much in my mind. But I'll be happy to try it out one day. One of these days, these reps, I'm too busy right now. They always kind of come by before the end of the year. But like next year, I'll take a look at some more devices and see maybe there's something I'm missing with this Alma hybrid. The rep always tells me to go try it out there too. But yeah, like I said, I'm like comfortable with what I'm using right here. So I don't know what the difference would be for me to use something that's just a fraction in a blended laser right there. I'm looking at the device right now. It's like, okay, cool. Like, it sounds like it'll be easier for somebody to use if they don't have multiple devices, but I do have multiple devices, and it's like works out better for me that way. Do I put clindamycin, tretinoin on my whole face or only where the acne is? You could do the tretinoin the whole face and the clindamycin in the areas that are affected, like the active lesions over there. What time is it there? It is 9:27 p.m. Pacific time. Why not get a deep chemical peel? Well, it depends on your skin type. It depends on how much downtime you have. What's really happening there. If your skin type is darker skin type, a deep chemical peel could cause catastrophic pigmentation issues. What's the difference between erbium and CO2 laser? Well, the erbium laser and CO2 both ablate water. So they basically are only absorb water. And what ends up happening for that is that, they are essentially one of them, the CO2 laser does with ablation and coagulation together. So it actually also melts some of the vessels, whereas the erbium laser doesn't do that really. It's unless you change up some of the settings there, but it's not actually giving you as much heat. So it's nicer for darker skin types. Erbium laser is nicer for darker skin types, but it also doesn't remodel and restructure the skin the way a CO2 laser really. It's nice for like a superficial blending approach. It's also nice for just like getting that skin texture really, really good. It's really good for that. But I find for deeper, thicker scars, you may need to actually do more like a CO2 laser, especially for like more like spot treatments and things like that. Hi, Joey, by the way. How's it going? Good to see you on. I know it's late for you, so I appreciate you coming on. Let's see here. And I know I missed a few things. Regina's saying, just saw your practices local to my area. Definitely would like a consult for my skin concerns. Look forward to it, Regina. Just schedule an appointment over here and we'll be able to help you out with it. Just go ahead to drqazi.com. We'll help you with that. What's the downtime of subcision? Really, it's about 4 days. Really about 4 days for that. Would you recommend microdermabrasion in between laser treatment? No, I think that's not going to help you out. It's just a waste of money and potentially just going to irritate your skin too much. Let's see here. Do you need to put spoon on eyes? It's not a bad idea. It helps with lymphatics, but better probably to do something that's going to actually help with lymphatics more, which is going to be like Claritin during the day, also like Benadryl at nighttime for a couple of weeks. Those things help. Also, Flonase helps as well. Those things actually would probably be a little bit better and more long-term solutions there. El Tapo Chico is saying, scars affect mental health. Where can I read up on this? I'm not sure if anybody talks about it that way. I don't really know. I'm not sure if people really talk about the mental health aspect of it. I know, like I thought before, really, it sounds almost ridiculous when I say it now, but like I felt like I had really severe scars at one point. I really did. And I was like so obsessed with it and so upset about the whole thing. And I definitely did have very more cystic acne for sure. And like very, very oily skin for sure. But I thought that like, man, my scars were like really severe. I didn't know anybody in my friends group that had like acne and scars. And like my best friend in college, he was like a model that like took me to like a lot of parties with models and stuff like that, and they had perfect skin. And I just felt like I was like the only person there without like perfect skin. And so it seemed like it was just like I just had the worst skin I've ever seen, and that's what it felt like. But it turned out like it wasn't the case, but like it still like, it affected me mentally. It was like my mental health was like, affected by that. It felt as if, it increased loneliness for me. Some days I would get like acne. I didn't want to go out. Some days I was thinking to myself that like maybe my scars are just a little bit more visible, and I didn't want to do anything. I didn't want to go anywhere. And I really do think it actually, it causes loneliness. I think a lot of these things cause loneliness. I think a lot of these like insecurity types of things, like physical insecurities like that do. And it's really interesting because it turns out so many people actually have it. And people that like have like really, really good skin, otherwise you think, they still are concerned with that. They still worried about that. And they sit there and they're stressed about the way they look and the way that it makes them feel, and they think that other people are judging them and things like that. And maybe they are, maybe they do feel like that. But I wish we kind of look back after you do get clear skin, you could kind of tell yourself that it's going to get better. It's like it'll be really nice, because I know a lot of people like look through this and feel like it's like hopeless. I remember when I was a teenager, my dad was telling me that it's going to get better at some point. He did tell me, he's like, it's going to get better. I was like, when did that happen? And he's like, oh, when, I was like probably like 25, 26. I'm like, oh, I was like 15 or something like that. I was like, that's 10 years down the line. It's like terrible. I'm not going to wait like 10 years. I thought it was like the end of the world. it turns out like, it came sooner than that. And it was like, ultimately it did get better then. And I kind of wish I did tell my 15-year-old self that like, it is going to be like great. Someone's asking what's my skin regimen. So I usually do a few different things. I mostly do some sort of tretinoin, like during like summertime especially, and then I kind of back off on that during the winter time. And then I do like more of I usually also do like a pigmentation cream that I typically do for like the rest of the year. And on top of it, I do mostly moisturizer, and I also do a hypochlorous acid spray. So I do that kind of a few times usually too. That helps actually as well. Something else to consider there. So just, mostly that's what I do. And like also, of course, like lasers every few months or so. And that helps out there. What college did I go to for undergraduate? I went to DePaul University in Chicago. That's where I grew up. I grew up in DePaul, actually. I originally majored in international relations. I wasn't going to medicine, actually. My dad is a physician, and I was like, I want to go and do a different route because like so many other people in my family were physicians. I was like, it just seems like you're kind of, once you become a doctor, you're sort of stuck in the medical world and you don't get to do other things. And so it's like, I went to DePaul, actually. Actually, interestingly enough, it has a very good international relations program. It's like a really good international relations program. Like I was like literally like always studying for that. And then I ended up like kind of circling back to end up going to med school afterwards. Is it a good school? I wouldn't necessarily say it was good for science stuff. So this is why I didn't do it there. I think international relations was very good. I think international relations was really, really good. I heard marketing was good as well. But science stuff, I think, was not as strong over there. Like I didn't feel like it was emphasized really properly over there. Honestly, it turns out like I was talking to one of my patients today when I was doing a procedure, and they were like in school and like they're worried about MCAT and things like that. And it's like, it turns out it doesn't matter as much as people think. Yes, there's like a clearer pathway sometimes that people have, but maybe like some other ways around it, ultimately get you to the same point. If you go around like a circular route the way I did with like international relations and do a whole bunch of stuff, I do actually find that my international relations stuff was actually really relevant. It was like about like logical stuff. It was about like game theory a lot. I'm never shocked by like the world anymore, like at all. Like it just like, it follows game theory really, really well. And so it's like, once you kind of understand that, actually a lot of things make sense. And so it's like, I think it was really helpful, actually, interestingly enough. So even if you don't go about the original plan that you had in life, it's like you really could go about like a different way. Like you can still get to your ultimate end goal. You can still get there. Even if you originally were planning like one pathway, don't feel like you can't go there another way. And maybe you could end up doing that. Anna and Nina saying digital marketing there is one of the best. They didn't actually have that in my time. That's a new thing. I graduated there in 2004. That's how old I am. 2004. Bro, why are you talking at 1.5 times speed? Sorry, I didn't realize I was talking. I usually talk kind of fast, but I didn't realize I was talking that fast. Sorry about that. Thanks for catching that on me. So I'll slow down a little bit there for you. Let's see here. How do I know if I have rolling scars or boxcar scars? Well, sometimes it's actually a bit of a mix, and so it's a little bit confusing. It's not as if like a scar just sticks to like sort of that category. Sometimes you'll see an ice pick scar evolve into a boxcar scar, or you devolve, I guess you could say, because it gets a little bit worse because sometimes it's a boxcar scar. It gets a little bit wider, and sometimes those boxcar scars are tethered and stuck. So it's not necessarily just like it's only a rolling scar, only a boxcar scar. Sometimes it could kind of morph into both of those things. The ways to sort of test it really are by pulling on your skin and seeing if the scar is really still bending down, and then you can know if it's really tethered or pulled down a little bit there. So for me, that's what I do. I test it all the time. I have patients smile as well. And even when you're in the room and we're talking a lot, or doing our Zoom calls, most patients, by the way, do come from out of state, just so you know. About 65% of our patients come from out of state. And we do a lot with Zoom calls, and we go through the case really, really well to see what we're going to do when you come in. And I'll test you, while you're doing this, like I'll have you smile and like do it under different angles, and you'll show me different photos, and we could really really establish where the tethered bonds are. And it's very, very clear with that. And then we can have a very good game plan. But yes, thank you, Sailor Moon. Yeah, that's exactly right. I usually just stay on for 30 minutes. I'm just staying on for a little bit longer right now because there's been a lot of good questions. But usually that is why I talk a little bit faster, just so you know. Let's see here. MH is saying, I can understand it is sleep time. A lot of people are not even understanding. Sorry if you were not understanding. I'll try to be a little bit clearer for you in the future too. So I did not realize I was talking that fast. I'll go a little bit slower so you guys could catch me a little bit better there. Do chemical exfoliants help scars? I think it'll be pretty mild. Honestly, I don't think it's going to necessarily help with scars, but it's a good idea. Just do it once a week, like a glycolic acid. Actually, Paula's Choice glycolic acid is pretty good. So try that. Try glycolic acid. It works out very, very well. Just do it once a week. And why Ray is saying you don't talk fast. I appreciate you. I didn't think I was, but if people are saying that, I respect it because I want people to be able to understand things and make it as approachable and easy to understand as possible for everybody. Emily is saying, are there long-term effects of using spironolactone for acne? Not really, no. It's a very, very safe, well-tolerated medication. And, I was actually talking to a patient today. I don't know if are you the patient that I was talking to today? But she was asking me a few different questions about acne and potentially the long-term consequences of spironolactone as well. But there really are not really long-term consequences of it. It's a very, very well-tolerated medication. And in fact, we know that it's protective of the heart. The issues with it are that if you're on medications that can also affect potassium, your potassium can rise with it, which is very rare for most patients. They're younger patients that are doing it for, let's say, PCOS or for just acne. So unlikely to be the case. Or if you have like lower blood pressure. So some women, especially like smaller women, can have blood pressure that's already like in the 80s. And if you put them on spironolactone, it can lower just a little bit, and that could be a little bit dangerous for them. So those that are probably the bigger things that you'd be worried about. Other things are that if first of all, it's a little bit difficult to get pregnant while on it. You really should be using a contraception while on it because it could affect a male if there be the fetus if it's a male fetus. So it could affect that as well. So those are things that you would want to pay attention to. But other than that, it's a safe medication. Tiffany Starr is saying, do you do microneedling? Do you feel CO2 or microneedling is best for acne scars, large pores? So it's possible neither is great for large pores. Really large pores, what I would assume you mean is more like ice pick scars. And that's really what we're doing over here, which is TCA Cross. I know someone was asking what we're doing over. That's TCA Cross for deep ice pick scars right over here. And I'm using a paintbrush. Today I did paintbrush as well as tiny little needles. And we do that for those deep little scars there. Andrea is asking, did I ever answer the question? I missed what question it was, Andrea. If you feel free to repeat the question for me since I missed that there. So much is saying, you've talked about on live doing subcision only once and it being a patient needs, but on your website you discussed that it's normal to do multiple rounds of subcision. To be clear, your website discusses multiple rounds in your practice. I'll have to double check to see what was mentioned on my page about that, about multiple different types of subcision. We typically do with subcision is even this patient today, he did subcision elsewhere, and there were still tethered stuck bonds. And when I went in there, I completely broke it up, and he doesn't have to do it again. So in some cases, if it's like in the lower part of the face, we may have to do it again, but it's very, very rare that I would even have to do that. Very, very rare. So I'll have to double check to see what was placed on the website and what that context was for that. Do I work with estheticians? Not really directly. I think that they have a role for certain things, but I don't really work directly with estheticians in my practice. Lavanya is saying, can we only go through TCA Cross and no subcision? Sure, if you have ice pick scars, TCA Cross without subcision makes sense. So hopefully that helps. Hi G, how's it going? I didn't realize you were on, at least on right now. Appreciate you coming on. Is subcision with filler safe? I should say not usually, but a lot of times I don't do it the same day. But essentially I'll stagger it. We'll do the subcision portion first, and then we'll wait for some of the swelling to go down and do filler. I can do some of the collagen stimulating products like Sculptra, for example, deep to the bone potentially, or maybe even Bello filler in like select spots. But I don't do as much filler when I do subcision. Like today's patient, I was originally planning on doing with him some Belafil, but I told him that we may just blow it up so much that we're not going to be able to. And I had to do Taylor Liberator for his deep scars. And so I felt like I wasn't going to be accurate with the Belafil. I didn't do it then. MH is saying, can you do both Sculptra and Belafil? Probably not on the same spot, but in different parts of the face. Yes, we definitely could. And, MH is asking, is it good to put warm towels or ice packs on the face? For what? What's the purpose for that? Chris Manito is saying, how long does it take to see results? So myself, I did a laser February of last year, and right now, this month, my skin is better than ever. One of my patients that I saw just a few months ago said my skin looks better today than it did like a few months ago. So there you go. And I haven't even done a laser since that time, actually, since I saw them. So it probably was just like the skin quality was getting better. Like that's what it feels like to me too. It just feels better quality skin. And I did a ablative CO2 laser, but I also have done some Belafil, which is also, a cumulative effect as well for my skin quality. So it's possible that's also what they're noticing. But that's what they were saying. They're like, oh, I thought, a few months ago your skin was good, but I think your skin's even better right now. And actually, like a few other people kind of commented that lately. And I was thinking maybe it is. Actually, it does feel like it is too. Like it feels like it's a little bit better. So it's slower than people think, but it's also a lot cooler, that fact that it gets better and better. Like I was happy like 3 months ago. I was happy 6 months ago. I was happy a year ago with my result. And now it's even better than it was a year ago. That's pretty cool. I like that. So, how many other things like continue to get better and better? Sharia is saying, so CO2 laser isn't good for ice pick scars. Well, it could be if there's like thick edges around the scar, then I would do that more for that. But just by itself, probably not going to help too much for deep ice pick scars. Judith is saying, can you still get treatment if you still have active acne breakouts? No, we want to control it. What we use is either oral spironolactone, or we're going to be doing isotretinoin or the Cure laser. All those are good options to manage your oil production and acne, and probably some sort of topical antimicrobial like Dapsone or clindamycin. All options there. Anita saying you're an artist with the brush. Appreciate it. Actually, I love it's therapeutic for me. Like it's like someone was asking me about my hobbies. Like one of my patients, like, what's my hobbies? Like art was my hobby. Like, so it's like kind of cool like that. I guess to just do it for work. It's like, it actually is really, really cool. It's like I sit there and I do like a lot of art. Like it's not even just this. I do like facial balancing and sculpting, and like it's like really, really like just like I was doing someone's lips today. They were actually very complex lips, actually. Very, very tight lips. And it was like just like perfect at the end. And I was like, this is like, it's awesome. It's so fun to do that. It's so satisfying. It's like, it's so great to like have that. And I used to like always draw in class. I used to like spend time afterwards, after school, things like that. And I'll be drawing and things like that. And it's like, I got to do it at work. It's pretty cool. MH is saying, how long did you work today? You have good energy. How do you keep it up? I don't drink caffeine. I don't eat carbs at night. But I do drink a lot of water. I try to. In between patients, I'm usually running around grabbing water, and I think in general I just have like a lot of energy for like life. That's what it is. I have like a lot of like I really do just like love living and like love like just being present. So to me it's like I like this portion too. It's fun. It's really, really fun. I like appreciate this community, and I kind of really do remember what it was like when I was on like in your place and was looking for people and looking for things, and I would have loved to have somebody like explain things. I really would have. It would have meant a lot to me. And it was like, I really wanted to do that because it really was important for me to have that. I wish I could have gotten that when I was a kid. Gotten that when I was in my 20s. Like I wish I could have, when I was like running around looking for stuff and like trying to, and I was like lost. Nobody had results. Nobody was showing real results or anything like that. And it was like, I felt hopeless for a long time. So I wanted to be able to have something that provides that, because I think this issue like this, I was saying, it says scars affect mental health. It really does affect people, internally a lot. And there's an enormous amount of loneliness in this world, and an enormous amount of like anger in this world. And maybe like we should start chipping away at it, whatever field we're in, and kind of like just start pulling apart that aspect. And just in our own little world, we make it so that there's less of that. There's less anger. There's less of this hopelessness, and there's less of this feeling of isolation and loneliness. if nothing else, at least in like certain spaces, we could start feeling that way. That'll be pretty amazing. That'll be like something that we could really like push society for towards a really positive way. Anything to fade stretch marks. Well, erbium laser or CO2 laser works very well. Dilute radius works well. Other things aren't going to help too much, though, to be honest with you, really, to be frank. Do you do patients' injections personally or a nurse? Our nurses do injections, but I do them also. Yeah, I do a lot with them. I do a lot with that. It's just, maybe a little bit difficult to get on my schedule for those, but I definitely could do that. And Natalie's mom is saying, how do these types of scars form? In this case, this is from acne. This is from cystic acne. Abe is saying, tretinoin left me very bad PIE. Can I get rid of that? You could do azelaic acid 10% every night. That over a course of 3 months, it should fade a little bit more. And plus a lot of sunblock. Do you do consultations before treatment? Yeah, we book it directly on our page, drqazi.com. You can schedule a virtual consultation that way or in-person consultation that way if you're nearby in person, if you're further away, virtual, and we'll help you out. Send some photos. Our team will help set that up for you. Is forehead filler for softness or wrinkles? Both. It'll help with both things. It really works very, very well for that. Elizabeth or Eliza is saying erbium laser versus CO2. Well, it depends on what you're trying to solve. If it's more like superficial scarring, erbium laser works very, very well. Deeper scars, you may have to do more of a CO2 laser. Zinnia is saying, hi, I got treated with Dr. Emmer at Sunset in Hollywood. Sadly, I still don't have the results. I'm kind of losing hope after going to the very best. I feel like this was like... I'll just say this. I think that there's a way to do certain things, and I don't require, a certain amount. I don't require skincare products, things of that nature. I just require you follow my instructions of using moisturizer, sunblock, just a pre-treatment regimen. And there's a way that we could do this and achieve excellent results. I really focus on achieving that for patients. I think that, if you look at my page, it's almost like entirely this kind of thing and like facial balancing. And other people may do, other things like a lot more of like liposuction or other treatments. And maybe that's like more like their passion and their love and, other potential, things that are treatments out there. And maybe scars was sort of just like something that was added into the mix there. I'm not sure. But I could tell you that if you come to me, eventually, at some point, I have a lot of patients who've gone to other practitioners, a lot of patients, and universally they will tell you that it's very, very different. It's a very, very different experience with me, and the way I do it is from start to finish extremely different. So hopefully that could help you out there, to be frank, I'll just say this, like really to be frank, that like there's at a certain point you have to wonder that like somebody doesn't have standardized lighting and they use photos consistently for their results. You sort of have to wonder like what level of work they're doing, really, to be frank. I think we just have to kind of acknowledge that like maybe there's something about that, because like why is it that almost all results are just with like patient selfies afterwards? I don't know. I have most of my patients are out of state. More like 65% of our patients, probably more now this year, are from out of state, and we still are able to showcase standardized results over and over and over again. And it's like, I'm not sure why other people can't, especially people who have photo studios and everything like that. And, so I think it's something that maybe you should kind of consider, like that it wasn't necessarily the best that you went to. We could definitely help you out in achieving the best possible result, though. MH is saying, what was the worst condition that you successfully treated? The worst scars? I don't think that I was allowed to treat that. I should say, I don't think I was allowed to share that one. I asked a couple times for him, but I didn't want to ask again because he was sensitive about it. But his case was the worst case I ever had, because he had severe laxity. Even though he was a younger patient, he was an athlete and lost a lot of volume, lost a lot of fat, and was just very, very loose there. And so I had to solve his laxity as well as his volume loss and his severe scars. But I've showcased some patients that were really, really terrible. That had some really severe scars. I'll kind of end the night with that. So I'll showcase that for you. And you can see one of the patients I think was, let's see if I have someone that's with more severe case here. Just saying, can I prevent filler migration? Yeah, by placing it properly, by placing it at certain layers of the skin, you definitely could do it that way. Let's see if I have a very severe case that I can just pull up really quickly. Let's see. Well, I wouldn't say this is the most severe case, but just something I could grab right now. Let's see here. I think this is good to showcase right here. This is a good case, actually. This is a patient who had done a lot of different treatments, and we significantly improved his scars. I'll show you, I'll show you the process over here and show you kind of what we did. But you can see for his scars, he had very, very deep, thick scars. And actually, after this image was done, we did end up putting some Belaflow in there, so it looks even better now. But I haven't seen him; he comes from far away. I haven't seen him recently again, but it looked better, and I'm sure it's even more improved. I did some TCA Cross and some more Belaflow. This is a severe case actually right here. This was a patient with a significant volume loss, and he had a lot. And actually, he's somebody who very, very nice gentleman. But because of his scars, the way it made his face appear, it made him appear a lot harsher. And, he was really disturbed by that. So it's like a really, really nice. We evened out his skin tone. We did a lot of things to make it so that I did a very extensive treatment for him. We did do a few different things for him. We did, in this case, we did talar linear subcision. We did TCA Cross. We did ablative CO2 laser. And through the laser channel holes, I put a dilute form of Sculptra through there. And then I had him come back about a month or so afterwards. And then we did a little bit of we did fat transfer as well for him. And so then we needed to do a little bit more for Belaflow. He didn't actually have as much fat, so we have to do a little bit more Belaflow now at some point. So that's what we'll end up doing. At some point, if he comes in again, he usually comes in once a year or so. So maybe next year we'll see him again, and then we'll see where he's at that point, because I know he got even better results now at this point. How many rounds of CO2 needed to get rid of boxcar scars? Maybe like 2. Maybe it depends on how thick they are. It depends on how deep it is. And what skin type you are. But usually I find that like 1 to 2 is really good for a lot of boxcar scars, unless it's like particularly very deep and thick edges. Here's another patient. Actually, this is a really, really nice patient. You'll see he actually did his recently after when he came in for this photo. He then did some more like facial balancing stuff. So I'll show you his. I'll try to pull. This is not with somebody I would say is super severe, but actually he's somebody who did go to some of the people that were mentioned in our chat and found that they were not improving his skin. And you can see just how much improvement there is here. This is pretty close to like perfect. And it was like, man, this, he waited a long, long time for that. Waited a long, long time for really, really excellent results. And he finally achieved it. It was really satisfying for him. But the first 3 months he was saying, I don't know if I see enough difference right now. It was like really red, really like just raw and healing. And he couldn't tell that the skin was just getting better and better. And he's like, I just trust the process. I trust you. So I think it will. And then actually, he wasn't originally going to let us share photos, but then he came in a few weeks ago and is like super happy. And he lets us share photos for the scars. And you can see really, really nice improvement over there. This is just something I was just showcasing. This is not like the most severe case, but just you can see like pretty close to perfect for him, like pretty close. Pretty close for that, and it's like very, very obvious in like all forms of lighting for him. However harsh we put it in the office, it's very, very clear for him. And again, really satisfying case there. Can you show example of female skin, please? Yes, I could. Let's see if I could find a good example for you quickly. let's see here. I'll end with a female example here. Where are you guys located, by the way? Where's everybody from? In the meantime, while I look for this, why doesn't everybody put where they're located in the chat? Let's see here. Where's a female patient that I could show? Oh, actually, this is a really good one. Just a good one, because she comes in every few months and she just has amazing like porcelain skin. Look at this skin. Look at this skin. Let me show you this skin. Look at that. That's a really, she's really impressive results. She's somebody who didn't want much downtime, so she just comes in every few months. She literally comes in every 3 months or so, because she comes in also for her Botox around that time, and or Dysport, I should say. And you can see, just look at how good that skin is. Look at that skin. That skin goals, right? Like that's really cool. That's really good, right? It's achievable, right? Like that's really cool. That's like so it's a very good result. Very happy for her. She's super happy, like she's beaming. And, she was kind of like, she's actually one of those patients that like, at first you think that maybe like someone like her, the way she was is that, maybe we wouldn't be able to achieve it completely, because like she really did want more of like that glass skin look. We did ultimately get there. Like we did get there, and now she just wants to kind of just like always have that glow. And really cool, right? Like that's TCA Cross, that's with laser resurfacing. We also did some Bellafill for her. I've done it a few times TCA Cross, about 4 times TCA Cross, Erbium laser as well for her. I did initially the first treatment. I did do spot treatment of ablative CO2 laser as well. So you see those thicker edges. That's where I was talking about, where I traced that with the surgical handpiece of the CO2 laser. So like people say, can I get glass skin? Actually, the other patient, this gentleman that I was talking about earlier too, he also wanted glass skin. I don't say like glass skin because it's may not be achievable. It's like kind of like put it out of your mind. I do want you to feel really good about yourself and get close to what you want to achieve. But it takes a lot more work. Like this patient, she required multiple sessions to be able to achieve this one. This was, she just always wants to keep that then too, and like that kind of glow. And she knows that like nothing comes close to laser. She did a lot of things also, by the way, like a lot of treatments before she did this, before she got this result. Meaning like she went to a lot of different practitioners, did a bunch of microneedling sessions, and a bunch of lasers, all those things, and just felt like nothing was really changing the needle for her. And so here's as close to like perfect as you possibly could get, and she feels like that. It's really cool. Ray is saying South Korea. I think South Korea is good for certain things, but like I don't know about scars per se. Honestly, I'm not sure if there's necessarily full scar results I see from South Koreans that go there. I have a lot of South Korean patients actually. Alexa's saying I think it's pre-recorded. No, this is live. Just so you know, hi Alexa. I've never pre-recorded. If I'm like, it says it's live, it's live. I'm not gonna like trick everybody to go tell everybody that I'm on here and like go do a pre-recorded nonsense type of thing like that. And just so you know, it's like that's so not me at all. So like if I'm just not able to come on for some reason, sometimes my computer like crashed or something like that. I didn't like throw something out there like a live like recording. I think that'll be terrible for people. The whole point of this is that people can interact with me and like and ask questions, so that it's less daunting for them. And so this is definitely not live. Rhea is saying I haven't found any in South Korea. Yeah, Rhea, I have a lot of patients who went to South Korea or like even come from South Korea. I haven't found anybody that really said that there's great work for scars. I think they're good for a lot of other things like lighter treatments, but not necessarily for these scar treatments. Does CO2 laser cause hyperpigmentation on fair Asian skin? It could, yeah. We always pre-treat the patients before we do that. Most of our patients are Fitzpatrick 4 and above. We have a lot of patients as well who are Asian. Do live during the day for 15, 20 minutes. I am so busy. It's really hard. I try sometimes, but like I actually go on and then my team's like, there's like 3 patients waiting, please, like, don't even start that. So I'm like, all right. Sometimes I'm about to like do like a TikTok video, like to go answer someone question or something like that. They're like, there's like too many people right now waiting. Can you go see the patients? And I'm like, yes, sure. Because that's always first. So I'm like, let me go run over and go see some patients there. Anyways, guys, I went really overboard. Usually it's supposed to be for 30 minutes, but I've been enjoying the chat and everything like that too. So I appreciate all the questions. But I have a bunch of cases tomorrow, and then I will see you again on Monday to circle back with anything else. If you feel like there's other questions that you were were missed or anything like that, I'll be happy to help you with that. I'll be able to go through all those things as well.